Thank you for joining us today on the program, Healthy Living. I am Adesuwa Osa-Owage. Today we want to look at anxiety disorder. What is anxiety disorder? What could be the cause? Symptoms? What about treatment? This and more we're going to be doing today on the program, Healthy Living. And some persons usually ask this question: is anxiety disorder a mental problem? Yes or no? Anyways, Dr. Jolly Nusa Iguma is here and is going to be giving us answers to all of these questions. He's the CMD of Jonas Medical Center here in Benin City. It's nice to have you join us on the program after a very long while.
Good afternoon, viewer. Good afternoon, and this was how I do.
Thank you, Doctor. So today, we want to look at anxiety disorder. What is anxiety disorder? What do we mean when we talk about anxiety disorder?
Yes, anxiety is a group of neurotic illness that cause excessive and overwhelming fear, tension, worry, and this is capable of affecting the individual, social life, occupational life, and other daily activity. Of course, anxiety, like fear, is supposed to be a positive thing to the mind. We can actually distinguish between fear and anxiety. Fear is a response to a known external threat. Whereas an anxiety is a response to an unknown internal threat. So we can say simply that anxiety is a problem of the brain or is a problem of the mind. Generally speaking, anxiety affects the old and the young.
So
statistically, it has been found to be common in female as compared to male. This is as a result of hormonal influence. Not only that, in Nigeria, 1.5 million cases of patients with anxiety are seen clinically. So that's to tell you how common the problem is. Of course, anxiety, for as much as it's a brain or a mind-related problem, we can ascribe it to be a mental illness.
So
however,
we can comfortably say that anxiety
is a mental
illness.
But that is not to say that anxiety is as hard as other mental illnesses. Because most often than not, anxiety does not have psychosis as a symptom. It's a treatable condition. And most often than not, anxiety also tends to simulate or mimic other medical conditions. There are symptoms for it, and there are types of anxiety.
Let's look at the symptoms before we go for types. Look at the types of anxiety. What are the symptoms? What do we look at for? How do you know that you have this anxiety in you?
Yes, anxiety can be self-diagnosed. That's to say that when you have anxiety,
you will know.
You can actually yourself tell to actually diagnose you. And many a times there is no even laboratory investigation that we do to say this is anxiety. For the fact that somebody with anxiety who have this persisting and overwhelming fear or worry, they come down with what you call somatic and psychological symptoms. Somatic symptom has to do with the physical symptoms. Somebody with anxiety will come down with palpitation, the heart beating very fast. Depending on what is triggering the stressor that tends to bring down, that causes that anxiety at any particular point in time. But most often than not, the stressor might not actually be there. When I was distinguishing between fear and anxiety. So it's a thing of the mind. Palpitation, the person feels the heart beating very fast. As if maybe there's a problem in the heart itself. But it's just because of the fear. It's just because of the anxiety that this person is having palpitation. And the person can also have headache. The person can also have trembling. The body will be shaking. The person can begin to have what we call diaphoresis or perspiration. Hyperhidrosis, that is sweating profusely. The person can begin to have trembling, can begin to have diarrhea, can begin to have frequent urination. The person cannot...
those kind of feelings you have when you want to write an exam that you're not prepared for.
Exactly. And of course, those one, we can say some of them are physiological. But when it becomes overwhelming, it becomes persisting, that is when we say, okay, this is an anxiety. And other than those somatic or physical symptoms, we also have psychological symptoms. Somebody with anxiety might come down with restlessness. They might come down with poor concentration. They might also come down with insomnia or poor sleep. I tell you that anxiety might be the reason why a child may not be doing well in school. Anxiety may be the reason why a clerical officer or an office worker might not be able to concentrate at work and perform excellently because the anxiety is there. So when you recognize those symptoms that for no reason, maybe you come down to an open space. When you are open, you are afraid of an open space, what we call agoraphobia. You are not able to stay alone in an open space, except you are with somebody. So you have this fear that something bad might happen to you. So you begin to have this, unpleasant or unnecessary fear. So at any point in time, you can even begin to have what we call panic attack. Your heart is like you are feeling doom as maybe the world is coming to an end. And there's not actually something that is triggering it. So in that case, we say this is an anxiety. So that will be more explained when we talk about the types of anxiety. Generally speaking, there are different types of anxiety.
Like how many? We
have what we call the generalized anxiety disorder.
Okay.
In generalized anxiety disorder, this is prominent tension, worry, and feeling of apprehension over nothing. And this may occur throughout the day, affecting the patient performance or affecting the individual performance at work. So you can also say that in generalized anxiety disorder, we can also describe it to be a chronic anxiety. The person feels worry over nothing. He worry about his or her health condition, worry about the economic situation, worry about the children, just worry. He's just ruminating. He's just worried. The mind is not at rest.
Worry over everything.
Exactly. So such person will come down with loss of concentration. Because anxiety affects perception, it affects thinking, it affects learning. So when you have anxiety, there's no way your cognitive function will not be impaired. So that is to say that a generalized anxiety disorder, which is also described as a chronic disorder, they suffer more of psychological symptom, which is restlessness.
But unfortunately, some persons may have all of these symptoms and refuse to accept the fact that it is anxiety disorder.
Yes. You see, in our environment, we stay for a longer time before we present to the hospital or present before a primary caregiver or a medical practitioner to say, this is my problem. Some of them, in this our environment, we have varying persons that we sought help from. Maybe the pastor, the head of the mosque, other persons.
Various persons.
Yes.
Like that.
So that is not to say that the sufferer is not aware that this is my problem. Okay. They will have consulted other persons for their problem. And because of our spiritual inclination in this part of the world, some of them just believe that it's a spiritual problem. So the something is there. You can see that somebody with an anxiety, as I said earlier, might come down with palpitation, the heart beating fast, or the heart, is aching or tightening. And it's not as a result of the fact that there's a pathology or there's a disease affecting the heart. It's just as a result of the anxiety. They live with it for a long time. Can
it lead to other problems?
Yes. Like as I said earlier on, it's a psychological problem. And it's a problem of the brain. So somebody with anxiety will have impairment in performing his or her work.
Okay.
Because if the person is a student you expect the academic performance to reduce over time. So if the person is a office worker, is not able to perform well, so you see that there will now be a kind of a personality change in this person. Why is this person like this? This person used to be very good, and you see, become bizarre, as the case may be. And I tell you that if though some anxiety goes on their own, because sometimes the brain has a way of, especially if there's a stressor that is involved.
Okay.
Because if we look at the causes of anxiety, we can look at the hereditary. Anxiety runs in the family. If a father has it or a mother has it, it's possible for them to pass it to their offspring. Because it's a brain thing. It's a thing that can occur in vivo and environmentally. So what I'm trying to say is that your body can cause you to have anxiety. Environmental cause may also influence somebody to have an anxiety. So other than the hereditary cause, we also have the environmental cause, which I just spoke about.
Yes.
Exposure to some certain drugs. Somebody that take alcohol, some psychoactive substance,
which is very common
yes,
in our society,
caffeine,
particularly
cocaine,
amongst the youth.
Cocaine and the like. Such person is most likely going to be prone to having an anxiety. And most especially if there is a withdrawal from those drugs, or they are unable to have an access to it, they come down with an anxiety. And difficult life situation or traumatic childhood, during the child upbringing, the child experienced what we call, difficult life situation or very traumatic life situation that will now result to post-traumatic stress disorder. Because I will tell you that anxiety is a response of the brain to stress, most often than not. And not only that, we also have what we call the neurotransmitter influence. There is a part of the brain that controls your emotion, your ability to be able to endure things. Of course, as I said earlier on, the anxiety is supposed to be a positive thing. Everybody, of course, can be anxious. Okay. If you are like interested in a certain thing, you are anxious, but that is transient, it's not persisting. Or your ability to be able to face danger. There is this brain, response, what we call the hypothalamus-pituitary adrenal axis, which
that's a long
yes, which help to secrete some certain hormone that enables you to fight, fight and flight. So without this brain response, of course, you can see that we will not be human in any way. But by the time this becomes persisting, or maybe the neurotransmitters has an aberration, of course, there are part of the brain that controls our ability to face stress, to face difficult situations, like somebody that is afraid of, a very large building or a very large object, what we call megalophobia. It's a form of a phobic disorder. Such person don't feel comfortable seeing a very large object. They fear. They can even, avoid such environments. Or maybe fear of animal, what we call zoophobia, or fear of, these are types of specific phobia.
Of space.
Yes.
Some persons cannot stand small space.
Yes.
Height.
Height, exactly. Acrophobia, they fear such, aerophobia. They cannot fly in an aircraft. So you can see that there's a part of the brain that regulates our response to all those things. So when there is a low level, or there's a depletion in those neurotransmitters, like the norepinephrine, the serotonin, and the GABA, aminobutyric acid. These are very, these are brain these are brain, transmitting substances that help to control our emotion. So when there's a depletion or a reduction, and what are those things that are capable of causing the reduction? Stress and use of psychoactive substance, other than brain trauma or brain injury. So when those substances are no more there, you can see that the brain tends to go the other way around, and the person can begin to have this kind of anxiety disorder.
Okay, let us look at anxiety disorder in children now. How can, because most of these children may not understand what is happening to them, but how can a parent diagnose this in his or her child? That, this child is not behaving as normal as other kids, or behaving, the way he shouldn't be behaving.
Yes. In neuropsychiatry, there's what we call attachment. Of course, a child should be attached to the mother
Okay.
to some certain age. And you know, there's still the age of schooling with which the child is expected to get detached from the primary caregiver
Yes.
and maybe go to school. But I tell you that there is a kind of anxiety disorder that is peculiar to children. So of course, primary caregivers, I mean father, mother, or whoever that is taking care of a child is supposed to be watchful, knowing that, oh, this child maybe in school used to be performing excellently, but now the academic performance is now dwindling down. So you can watch out for anxiety in this child. Other than that, there's what we call anxiety disorder, which is a form of, getting detached from the parents.
Okay.
So that might be the reason.
Kind of withdrawn
Exactly.
syndrome or something.
That might be the reason why this child will refuse going to school. So specifically, we call it separation anxiety disorder. You know, I started by telling you that there is an attachment. It's just like taking a child that is breastfeeding from the mother. The child cries because at that age, the child is unable to have an ability to get detached. But the child grows to a certain stage with which the child can comfortably live without being
breastfed.
Without being at the hands of the mother. So in that case, you can see that when the child is having this separation anxiety disorder, this child begins to feel that, oh, if I get detached from my mother, if I'm taken away from my mother, something bad might happen to my mother or happen to my father. That might be the reason why they cry, that they wouldn't like to go to school. So you watch out for those things. Maybe at a time this child, feel happy going to school, then you now see that this child is unable to, cope.
Yes.
The child cries.
Should investigate.
You will investigate the reason. Why is this child not willing to go to school like that? So, apart from the performance and watching out that the child always want to be getting attached to the mother, to the father. After some certain stage, maybe after 4 years, as the case may be, because at 4 years, the child is supposed to have, been able to get detached, get separated, from the parents. So you watch out for those things, because this separation anxiety disorder is very common in children. That might be the reason why there's poor academic performance, and that might be the reason why the child refuses going to school.
Okay, you just said that anxiety disorder is treatable. Now, doctor, talk to us. How can anxiety disorder be treated in adults and in children? I'm particularly concerned about the children, because most often the time, children go through a lot without being able to explain themselves, and parents may not be that observant to know that this is what is up with our child. So how do we treat anxiety disorder in children first and then in adults?
Yes. When we know the stressor or knowing the cause of the anxiety, of course, it will be easier for us to treat the anxiety itself.
So you go
this
to the
persistent fear, this overwhelming fear, of course, is abnormal. It's possible that a child gets unnecessarily, fear for snakes. Of course, we should get fear for snakes, but a situation whereby you even see a rope as a snake and you begin to scream, or you fear strangers, what we call xenophobia. So we can do a psychological treatment other than medical or drug management, as the case may be. So what I'm trying to say is that there is what we call cognitive behavioral therapy. Okay. So we do what we call desensitization, or we do what we call exposure. So we try and see the reason why this child is having anxiety. So through an organized techniques, we try and expose this child to that stressor, which tend to cause an anxiety systematically. So it's possible that this child is afraid of a particular thing. That's why this child is getting an anxiety. So we do this, we apply this psychological tool. So other than that, there are drugs that we can use to treat anxiety, either in children or in adults. Okay,
these drugs, are they going to be for lifetime, or it's just for a while?
It's just for a while. I explained about some neurotransmitters which are affected.
Yes.
So those drugs will help to modify those brain chemistry, set it up to be working well so that this person can have good cognitive function as a way of trying to avert or combat the anxiety as a problem.
Is it possible for one to relapse into anxiety again after being treated for a while?
Yes, it's very possible, just like every other illnesses or every other disorder. However, if a child is afraid of an open space, what we call agoraphobia, you know, this child is afraid to walk alone in an open space, or it's possible that this child have what we call social anxiety disorder. A child that suffers social anxiety disorder, which is a type of an anxiety, this child is unable to speak in the public. They might have what we call selective mutism. You see this child talking at home, but when this child goes outside, when he feels that in this environment, he or she can be scrutinized, this child just feels that if I speak in the public now, what I say might not be correct. People will begin to mock me or laugh at me. Yes. So this child is unable to face the audience to speak. So because of that, when this child, sometimes that might be the reason why some persons, when they're in class, they don't even talk in class. But when they're at home, you see them jumping around. So such child have what we call social anxiety disorder. They're not able to do well in the public. So when that child now is now systematically desensitized, you know, doing what we call exposure techniques. There are, you know, ways with which this is done. You know, you try and let this child get exposed to public places, you know. Before you know it, this child, of course, is unable to
You know, most of these things you're saying, we see it on foreign movies, foreign television, but I'm wondering if we have it here, because when it comes to children, it's very difficult to have doctors who really take children through all of that, or is it the parents that do not think it necessary to take a child to the hospital for the sake of anxiety disorder?
I tell you that when somebody, when somebody has never had a problem, you will not know that people also suffer the problem. So there is a unit, or there is a part in neuropsychiatry that they call adults, that they call adolescents and children. So there are children that suffer anxiety, and there are people there. There are, you know, practitioners there who know how to, you know, solve those anxiety in children. Yes.
But how many parents have that time to do that? Or how many parents deem it fit to take their children through that process? Because just, you go grow, come out time, you know, that kind of a thing. When you see a child throwing tantrums unnecessarily, parents don't see it as a big deal.
I believe that is the purpose of this
I'm saying it because I want you to talk about it.
Yes.
I want you to encourage it, because we have like 2 minutes left.
Exactly. That is the purpose of this education, orientation, and, you know, sensitization, enlightenment, yes. Okay. You see, in our environment, because of what we believe, you see this child, when this child was growing up, this child performed excellently well in school. Yes. And at a time, you now see this child academic performance dwindling down. So as a parent, you're supposed to call for concern. Okay. But in our environment, we will begin to even, you know, whoa and boo the child and say, you see yourself, we're going to take you, go and learn mechanic. I say maybe even the mechanic, they don't even use brain to even set.
All right, parents, Dr. Jolly just said it all. If your child is going through all of this that we've talked about, you should see a specialist about it. And if you as an adult is going through all of this, you can also seek medical help. So give us a call to continue this conversation on 080-3472-1750. The number again is 080-3472-1750. Call us on this number and we'll be able to continue with this conversation. Thank you, Dr. Jolly, for finding time to be with us today on the program. It's a pleasure for having me. All right, we'll see you guys again next week. Until then, always seek medical attention for whatever reason. You never can tell what may be going on with you. Bye-bye.